The sound is Latin music. The class is for people over 50. The mission for participants like Linda Schneider is to stay healthy and active. This is Zumba, an aerobics class with a beat all its own.
Dancing is something that I've done all my life. I was a dance major in college, so I've just continued on with that, and I intend to be a dancer. Once a dancer, always a dancer. I have something called osteopenia, which is the step right before osteoporosis. You don't have as much bone loss, but you can see the signs of bone loss.
This Zumba class is sponsored by H2U, an organization designed to help older people maintain a healthy and active lifestyle.
Come in.
Dr. Andrew Krinsky is an OB/GYN at University Hospital in Tamarack, Florida. He says one of the first things to be explored during a patient exam is the status of skeletal bone health.
Normal bone is a healthy living organ, and bone is constantly being built or rebuilding or being broken down or resorption. And this process is called remodeling. Osteoporosis results when there's an abnormal balance. Either not enough bone is being built up or too much bone is being torn down.
Michael Verga is a 56-year-old backpacker with osteoporosis. As she walks along this scenic trail overlooking the Golden Gate Bridge in San Francisco with her daughter Kendall, you'd never guess that Michael recently broke her leg. It's a common injury for those with osteoporosis.
I love the solitude. I love getting away from all the mechanism. And also it gives a great sense of independence, to be totally self-sustained.
Michael has spent 3 decades traveling from her home in Bakersfield, California, to backpack the wilderness trails in state and national parks. It is a passion she's passed on to her daughter Kendall, who's been on the trails with her mother since she was an infant.
I think it means a lot to her that I have something, that she's given me that she can see a little bit of her in me when we backpack and go out and we both have a great time.
Michael has been aware of the osteoporosis threat to her health most of her adult life. She watched her mother and grandmother suffer fractures and broken bones. It was on a visit to see her mother in Texas that Michael slipped on a step and broke her leg.
I had to fly cross country in this full plaster leg cast to be back in California to get the bones set.
It scares me a lot. It's hard for me to picture myself having a broken bone, or it's really hard for me to even understand what osteoporosis is.
Michael and Kendall live with the reality of osteoporosis, and they're committed to educating others. With the help of FOR, the Foundation for Osteoporosis Research and Education in Oakland, California, the mission of getting information to women about the disease will be easier. Kathleen Cody is the executive director of FOR.
We find lots of women who are shocked when they finally get a bone density test and find out that they are in fact at risk for osteoporosis. And it doesn't have to be that way.
At 51, Renee Lacey of San Ramon, California, never thought that osteoporosis could be a threat to her health. Her diet is high in calcium. She exercises regularly. But a bone density exam performed after a severe auto accident showed that she was at risk for fractures due to osteoporosis.
As far as I was concerned, I should not have been a person that was at risk for osteoporosis. There was a lot of information on the sheet, but the one thing that I went to was the diagnosis that said severe osteoporosis. And I wondered what in the heck happened.
This is a bone density exam. The test is simple, painless, and a requirement to get the right answers about osteoporosis and bone health.
The T-score compares an individual patient's bone density to the average bone density of a healthy 35-year-old. From this score, we can determine what this woman's risk is of developing a hip fracture and determine what her degree of bone thinning is at this point in life.
And I go out and talk to women all the time who can tell me their blood pressure and who can tell me their cholesterol numbers, but haven't got a clue about what their T-score is. We'd like to see women know what their T-scores are.
Michael Verga is organizing Hike for Osteoporosis to raise awareness about the disease and highlight the benefits of knowing T-scores.
This idea of Hike for Osteoporosis, in which women, especially women with osteoporosis or the potential, hike the national trails, backpack and hike the national trails, hoping it to be something like the Walk for Breast Cancer, the Ride for AIDS.
Michael plans to take her message to women throughout the country. She believes bone health is too important to ignore.